رحمن يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن.
Introduce to you Dr. Abubakar Jafiya, who is going to speak about overview of COVID-19 response in Nigeria.
Yeah, can you help me enough so that I can share my screen?
Yes.
So, Assalamu alaikum. Before the screen comes up, the chairman of this occasion, the Emir of Shonga, the president of Iman, Professor Orekba, and the chairman of the organization, to read overview of COVID-19 response in Nigeria. And the outline of this presentation will look at the global situation briefly, talk about the timelines and response structure in Nigeria, look at our situation nationally, and also briefly talk about what virus mutation is and what is our response to the viral mutation here in Nigeria, and what is our major response activities, what are our challenges, and what are our priorities in the next coming few weeks. Looking at the global situation, as of today, we have over 96 million cases globally. These cases are driven by the America has the highest, global, number of cases. Mortality, with America as well leading, cases of 1%. But this is the global picture. 2020, NCDC established what we call guide the nation in terms of preparedness case in the country, and this included testing capacity, healthcare worker training, identification and equipping treatment centers, guidelines and SOPs, monitoring of international travelers, and of course, this talking about the global picture and then the timelines of the response in Nigeria. And when the Nigeria activated the Emergency Operations Center from 20th of February, this Emergency Operations Center is coordinated, the activities of the center is coordinated through 9 pillars as shown on the screen. Also, we report to the Federal Ministry of Health, and then we have the umbrella presidential body, the Presidential Task Force that delivers on policy and other activities of the response. So the response, I'm going to talk surveillance. Surveillance is mainly has to do with case finding in communities, for cases in communities, looking for people that meet our case definition for testing. Our laboratories have been increased to 112, meaning that at this current point in time, we have laboratories in all the 36 states and FCTs. Some states have resumed from 5th September. Working with the port health services, we tend to monitor all travelers that are coming into Nigeria. For case management, also we have developed guidelines and issued support to both patients in the hospital and home care. Cases protocols, people will learn about COVID being a new disease globally. Risk communications, online and offline media engagement, and information management system to ensure that resources don't have effectively managed. We have also trained over 4,000 health staff on infection prevention. As of today, we have over 120,000 confirmed cases in the country. Of this 120,000 confirmed cases, 89,317 have been discharged. 200 technology as well. So I was just saying that the drivers of the outbreak in Nigeria are Lagos and FCT, as you can see on the map on the right-hand side. each of them having over 10,000 cases. Some states like Nasarawa, Plateau, and Kaduna, also Bauchi, also having large number of cases. So on the screen on the left-hand side, the situation update as of today, 120,000 cases with 1,495 deaths, with case fatality of about 1.2%, I've mentioned. These are the national epic curve showing the daily and the weekly cases. You will see that the cases continue to rise. We are already in the second wave, starting from December. The cases have risen. We have seen a large number of rise on 22nd of January, as mentioned earlier. This is also showing trends of testing and confirmed cases. There have been a decline in testing in week 3. However, these figures are being updated. Today is the last day of week 3, so we'll update that and share as appropriate. Also, test positivity has increased in week 3 to 15%. As I said, testing figures are yet to be updated for week 3 also. So in the last 4 weeks, we've been seeing that there have been increase in cases in 24 states. Those states that are shaded in red, there are similar stable cases in 3 states, those in yellow, Borno, Gombe, and Adamawa. And we have seen decline in 5 states, those states that are shaded green. Also, there are too few cases in an additional 5 states, and we cannot really say the trend of where the cases are going, whether they are increases or decreases. That is not available based on the number of cases that they reported in those 5 states. Also, Kogi State has not reported a case in fact, in about 200 days, we have not seen any case with, and this is largely due to political reasons. 4 states I mentioned, Lagos, FCT, Kaduna, and Kano, reported over 1,000 cases in the last 2 weeks. The relative distribution of states have so far reported confirmed cases. 36% of all confirmed cases, 66% of all cases are in 5 states. That is Lagos, FCT, Plateau, Kaduna, and Oyo. 38% again of cases did occur in the last 6 weeks. Talking about the second wave. This is looking at the proportionate contribution of cases in 10 states. You can see that Lagos accounted for about 40% of cases that we have seen in the last 10. So 4 states mentioned here, Lagos, FCT, Kaduna, and Plateau, accounted for over 80% of the cases. This distribution of cases. Cases are low in children 0 to 4, 5 to 9 years of age, and in the elderly from 84 to 85 and above 85 years of age. Over 50% of the cases are in age groups from 25 up to 44. The slide on the chart on the right hand side shows a confirmed death with in terms of age and sex. There seems to be increased mortality amongst the older age groups and higher mortality in males than in females. This is showing COVID-19 in children over time. Trends in cases in children have been similar to what we see in adults. There are minimal changes within each age categories as well. On the left-hand side, we see steady increase in deaths. There have been decline in deaths from around 41 up to 48, and then we started to see a rise, in what seems to be the mortality due to the second wave of COVID-19 in Nigeria. Despite this increase in mortalities, the case fatality rate has continued to remain stable. Also, this is showing the COVID cases in the last 3 months. You can see the rise. These are absolute numbers with high increase in January, and we are not yet out of January. So one other area that I want to talk about is about viral mutation and public health. We all know that viruses mutate all the time. There is always a new variant, and having a new variant is not news. However, what we are concerned with is if there's a variant that increases or decreases transmission, if there's a variant that increases or decreases severity or mortality, or if there's a variant that has increased responsiveness or decreased responsiveness to vaccines and therapeutics. So a few variants have been identified in UK, South Africa, and Brazil, which are contributing to increased transmission in those countries, but of course not severity. Here in Nigeria, globally, there's an ongoing study by Public Health England and CEPI to understand how variation will impact on, our current vaccines. In Nigeria, in response to the mutation, what we've been doing so far is to strengthen sequencing of samples in collaboration with SGIT, and also we've strengthened the pre and post-travel testing, especially for persons coming from the countries mentioned, UK, South Africa, and Brazil. All samples from these countries, all positive samples, are being sequenced at the National Reference Laboratory here in Abuja. So what are the major response activities that we have had in the last 1 year? We've trained over 4,000 health workers across the states in terms of IPC. We have also digitalized our surveillance system through the SOMAS. We have established a strategic national stockpile and digital supply system serving all the states. We have also deployed rapid response teams across the states and the LGA. And like I mentioned earlier, we have labs spread across all the 36 states and FCT. Some states have 2, 3, and so on and so forth. We've established infectious disease treatment centers across all the 6 geopolitical zones. And we continue to scale up risk communication across states and the national level. So what has been the key challenges so far for this response? What we have seen is that there's low risk perception amongst the general public. Because of this second wave, there's been increased demand for specialized care, need for additional and regular oxygen supply for treatment centers. It's some sort of challenge. We have inadequate resources for response activities, and there's need for additional staff and funding vehicles across a lot of states. We're able to just, support the states that we can as the resources are available. There is a lot of rumors and misinformation, especially, around vaccination. And then the general public do not adhere to pharmaceutical interventions. We have inadequate funding for health security in Nigeria. And because of the prolonged response, there is resultant fatigue in our healthcare workers. So what will be our major priorities in the coming few days? We've seen that there's increased demand for testing, so we need to engage more private laboratories and, of course, commence the use of rapid diagnosis test kits. By this week, starting from tomorrow, we're commencing the introduction of a pilot use of rapid diagnosis test kits within the tertiary hospitals in the FCT before roll out generally to the, across the country. We need to have a clear approach to respond to cases in closed settings, like in schools and in NYC camps. Most importantly, there need to be decentralization of these response activities, because the pandemic seems to is going to be with us for a long time. So there's a need to decentralize the response. There's a need for the local government level to take, additional responsibilities. We need to continue our engagement with the community and religious leaders. Some states have commenced the enforcement of NPIs, and I think this is a good thing. We need to encourage that. Well, NPIs seem to be what is available to us without vaccination to be able to control this, pandemic to a large extent. We'll continue to strengthen response activities across, all the pillars, working with the state. We regularly engage with the state. We talk to them. We share ideas, good practices, and so on and so forth. We're in the process of developing another incident action plan for 1 year. What we had before ended as of December, so we are now developing a new incident action plan. We continue to support preparedness of vaccination campaign that our sister agency is leading, the National Primary Healthcare Development Agency. And so with this, I want to say thank you, and I really apologize for the issues that we had with the internet.
يا رحمن ساعدني يا رحمن اشرح صدري قرآن املأ قلبي قرآن